Hi, my name is Jack Dixon. I am a physical therapist at our Providence location, and I am one of the lead faculty members of the Highbar Orthopedic Residency. So I did a residency mostly to improve my own confidence. You know, especially when you're straight out of grad school, you think that you're gonna have all the answers. You think that once you're finished the schooling, you're gonna know exactly what you need to do, and that's just simply not the case. You get overwhelmed easily, you wind up in situations where you wish you knew what the right move is, and having the year-long continuing education, having the mentorship, having the resources at your disposal really helps, give you the skills to manage things, but it also gives you the underlying feeling that like, hey, I know what I'm talking about. I know what I'm about. I know when things are serious and when things don't have to be. I would say that the thing that the residency gave me that, I wasn't really looking for while I was applying was like the interpersonal resources. So just having people that I could bounce ideas off of was something that I didn't value enough when I was first coming into the field. And now, I have a lot of people who I respect immensely. And so being able to reach out to them to help with patient cases or just professional situations where I want to be able to do better. That was the thing that was I would say the biggest surprise of the residency. Well, professionally, it made me so much more confident. It allowed me to know that I am operating at the top of the field. It really allowed me to focus myself and to be able to say, I have gone through the literature. I am an expert at your diagnosis, and I know how to get you better and not have to second guess myself. And it also allowed me to take that experience and translate it into helping others too. So being able to be a good mentor and being able to help people, be the best that they can be at orthopedic physical therapy is something that I appreciate immensely getting from this experience. I think people who are highly motivated would do well in a residency situation. If you are someone who is always trying to get the most information that you can, or always trying to do the best that you possibly can, it is just going to make it so much easier for you to be able to complete that. It gives you the resources to operate better. It gives you the support to be able to push yourself and to be able to do it efficiently. Everybody is going to be able to, find their own path. But if you have one where it's set up already and you have everything that you need in order to succeed, it just makes it so much easier. I think that, people do look at me differently, but I think that has a lot to do with the way that I'm able to communicate. So, I don't think that having OCS at the end of my name fundamentally changes the way that people address me and look at me, but people use me as a resource because they assume that I know a lot of information about a subject they have questions on. And that is something that is a direct result of the residency, because I am exposed to more information and because I have had to apply that in the past. And so it makes me more of an expert than I was before. Well, as far as like balancing work with everything outside that you need in order to be a healthy human being, we design the residency to make it so you are able to do everything without taking up an inordinate amount of time. I would say that when I was doing the residency, there were some times where there was a lot of work at one point, but on average, I would say I was spending somewhere between 6 to 10 hours a week on residency assignments, and that is not a ton. That is something where, I was able to take an international trip while I was doing the residency. I was able to go home to be with my family and not have to be distracted by it while I was doing that. I would say, honestly, the hardest part was the studying for the actual OCS exam. That was less to do with the residency structure and more to do with the fact that there are thousands of topics covered on that godforsaken test, and you just have to be prepared for as many of them as you can. When you're doing the residency, especially when you're employed at Highbar, you have multiple points of contact for people who are looking out for you, because you have your residency mentor, and part of their job is educational, but also part of their job is to make sure that you are being put in a position to succeed. So when I was doing the residency, Jake was my mentor, and he would start most of the sessions being like, are you getting sleep? Are you getting time to do what you want to do? Do you feel overwhelmed? And just being able to talk through things with someone is just a huge resource to have available. And when you're at Highbar, you also are going to be getting support from your clinic director, because your clinic director is going to be highly invested in you not burning out. And so they are going to be checking in with you. They are going to be seeing how things are going, and they are going to be another resource to bounce things off of. You are also going to be having support from the people who are running the program. So Bobby Datillo and the other lead instructors are going to be checking in with people if they feel that A, you're underperforming, or B, they feel like you aren't able to perform as well as they were expecting, to see if there's something going on with you, and to be able to help build up a strategy so that way you're able to get everything accomplished that you want to without overextending yourself. When you're looking at residencies, you want to really get an understanding of what this residency is going to be doing for you. Because sometimes it's really easy to phone it in, and it's just like, we have recorded lectures, we'll meet a couple of times a year just to go over some things, and you'll get a lot of information, and we can guarantee you'll pass the OCS. And that's great. That's information, and it'll probably make you a better clinician. But the real question is, are you going to actually get that one-on-one support? So at Highbar, we are spending 150 hours one-on-one between you and your mentor, and that is going to be the mentor watching you work, you watching the mentor work, and the two of you game planning. It can be talking about cases, it can be talking about studying, it can be talking about life management. And that is a huge resource to have, because even if you are in a residency where these people are available, if it's not in person, you're not going to be likely to ask these kinds of questions over email. So these kinds of questions aren't going to get asked, and you're missing out on a huge opportunity there. I would ask them, why do you want to do a residency? Because if you want to do a residency because you feel like it's the natural progression, that is not a good reason. That is inertia is not going to motivate you to do a full year worth of work for this. If you want to do a residency because you feel like there are specific instances in your career where you would do better if you just had more information and if your problem-solving skills were better, that is a really good reason to go out for that residency. And I personally believe that people should work for somewhere between 6 to 12 months prior to applying to a residency, just so that way you have your feet under you. You don't want to do a residency to learn how you want to operate as a PT. You want to do the residency to really refine your skills and to optimize what you're already doing. And if you finish PT school and then 3 months later you're starting a residency, that's effectively an extension of your graduate education, and you're not really giving yourself time to see how you're going to apply what you've already learned into an unsupervised physical therapy setting. So with that, I think a lot of people can benefit from residencies who aren't new grads, people who have been in the field for 5 or 10 years and feel like they are in a rut, or they're just doing the same things over and over again, and they're not sure if they're practicing as best as they can. So to me, a teaching practice is something where everyone is there to learn. Everyone is there to exchange ideas. So grad school is not a teaching practice. It is a lecture practice. It is where some people are coming in to learn and other people are coming in there to teach. In a teaching practice, we expect that everyone is coming in with the expectations that they have expertise that they would like to share with other people. Because that is what we want in a real life situation. We want people who are better at certain things than others because that's a necessity for specialization. No one person is going to be the best at every single thing. And so even sometimes when we have student PTs, they are going to be more up to date on certain parts of the literature just because they've been in school more recently than we have. And so they can come in and they can say, hey, I actually read an article that said that this isn't really supported anymore. And in that situation, if you are a teaching practice, there should be no animosity. You should not be fighting against that information. It should be something that you are trying to incorporate into your practice. Because I can honestly say that I have had multiple students where through their lecture, through the presentations that they did, or just the research that they'd been exposed to, they have fundamentally changed the way that I treat my patients. And I am very thankful for that. And so that is the kind of energy that I try to bring to my students, where I am constantly trying to bring information, bring the research, and talk about my own expertise to try to help them incorporate into their practice the best that they can. Once you have the opportunity of going through a residency, it means that you are an expert in your field. And once you are considered an expert, it means that you are going to have more opportunities for education. So it means that people are going to want to have you as a mentor. It means that people are going to want to have you involved with continuing education, but they're also going to want to have you in a position where you can help other people with their clinical decision making, whether that is mentoring new hires, whether that is working on case discussions in the clinic. It gives you the opportunity to have more of a senior role in pretty much any situation that you're going to